Controlling nosebleeds. For an active nosebleed, lean forward and pinch the soft part of the nose, squeezing the nostrils shut for at least 5 minutes. You can also place an ice pack or cold compress on the bridge of the nose. If the nose is still bleeding, continue to pinch for 15 minutes. Oxymetazoline and phenylephrine are nasal spray decongestants that can help slow nosebleeds. To use, first blow the nose to clear any clots, then use 2 sprays in the side that's bleeding. Continue to hold the soft part of the nose for 5 minutes. To prevent nosebleeds, avoid nose trauma, forceful blowing of the nose, and picking at the nose. Keeping the nose moist will also prevent nosebleeds. This can be done with nasal saline mist, 1 to 2 sprays 2 to 3 times a day, or ointment at bedtime. For the ointment, put a dollop on a fingertip and wipe across the nostril, sniffing in to distribute the ointment. A humidifier at the bedside is also helpful. Things that are associated with nosebleeds include dry or cold air, allergies, cold sinus infection or upper respiratory infection, deviated septum, mucus crusting in the nose, or a bleeding disorder. You should seek medical attention for a nosebleed if the bleeding is longer than 15 to 20 minutes and cannot be stopped with direct pressure. If there is rapid or large volume blood loss, vomiting, difficulty breathing, or if the nosebleed was after trauma or head injury. In the clinic, chemical cautery can be done on one side of the nose at a time to control nosebleeds. A cotton ball is soaked in an anesthetic and a decongestant and is inserted into the nose for 5 minutes. After it is removed, the chemical cautery using silver nitrate will be applied for 10 seconds. The nose will sting for about 1 minute, and healing takes 2 weeks, requiring the use of saline spray and bedtime ointment. Potential risks of chemical cautery include that it may not control the nosebleed. There may be injury to other parts of the nose or face, discomfort, decrease in sense of smell, septal perforation, which is a hole in the wall inside the nose that separates the 2 nasal cavities. If chemical cautery doesn't work, electrocautery can be done. Electrocautery is usually done in the OR and has the same risks and post-procedure care. Electrocautery provides a more efficient control and can control an actively bleeding nose. This video is for informational purposes only. If you have questions about your own health or that of a loved one, contact your own doctor for advice. Controlling nosebleeds. For an active